Welcome. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at www.nahatica.org. After completing this webinar, please upload and complete the quiz. If you're interested in receiving a certificate, you can find the quiz in the file pod throughout this presentation on our website at nahatica.org, or you can email traininginstitute@nahatica.org. You can email, mail, or fax the completed quiz. Contact information is on the quiz itself. If you're a member of NAHATICA or NADAC, the certificate for this webinar is free. If you are not a member, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar, if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this 1-hour event is pre-approved by the New Hampshire Board of Licensing for alcohol and other drug use professionals, as well as the MBCC. If you have any trouble viewing the webinar, audio problems, or have any technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to traininginstitute@nahatica.org. You can find and upload these introduction slides in the file pod to the right of your screen. And with that, I'm going to turn you over to Gia Drew to talk to you about Transgender 101 today.
Great. Thank you so much. Hello, everyone, and welcome to Transgender 101, an introduction for substance abuse professionals for the New Hampshire Training on Addictive Disorders. My name is Gia Drew, and I'm a diversity educator. So let me give you a brief overview of what we're going to be going over today on our webinar. This 1-hour Transgender 101 presentation is a basic introduction to what it means to be transgender. Included will be information about why we should become better informed about this issue and what it is like to be transgender in society today. The presentation will address terminology and language that is supportive of transgender people and the situations they may face navigating family, work, and transition should they decide to do so. There will be facts about the barriers and stigma transgender people encounter and a summary at the conclusion. So let's go over the agenda of this presentation. We'll do a brief introduction and overview of what we're going to be talking about today. I'm going to clarify what's included in this presentation, why we're discussing transgender awareness, which is really important. We're going to hear firsthand accounts from transgender people. We're going to understand terminology related to transgender individuals. We'll spend some time reflecting on data on transgender issues, and we'll have some time to review what we learned in the presentation. So I want to start with a little bit about who I am and what I do. So as the presenter, my name, like we said, my name is Gia Drew. I use the pronouns she, her, and hers. And that's a picture of me. I'm a diversity educator and consultant. I'm also the program director for an organization called Equality Maine. Equality Maine has been working for 32 years to advance the rights of LGBT people. I'm also the board president of an organization called Maine Transgender Network. It's a nonprofit that provides education, support, and resources for the transgender community in Maine, and I've been with them for about 8 years. Before getting involved with LGBT activism, I was a high school coach and teacher for about 20 years, which was really exciting. And in that time, I became one of the first out transgender public school teachers in Maine, and one of the first transgender coaches in the country. It's not something that I set out to do. It's just something that happened, and someone pointed out to me after the fact, hey, I think you might have been the first. And we're going to talk a little bit more about what that was like for me to come out on the job and some of the barriers I faced and what other barriers other people face when they transition. So So I'm excited to be here to present this webinar. So let's get into some of the content. So here are a few learning objectives, and these are some of the highlights of what you're going to learn today. Most importantly, you're going to learn what does it mean to be transgender. I know there's a lot of talk out there about what this word means, and we're going to address what that means to be transgender. And I will go back and forth between the word transgender and trans, just so you know, they are synonymous. So sometimes it's a lot easier just to say trans versus the long transgender, but they mean the same thing. We're also going to understand language and terminology related to transgender people. I know that language can be really complicated around LGBT issues, and it's constantly evolving. So hopefully what we go over today is going to be helpful for you to understand how to be supportive when talking with or talking about transgender individuals and people in the community. We're going to review some best practices when interacting with a transgender person or the transgender community. And then we'll talk a little bit about the issues that transgender people face in society today. So those are our learning objectives for this webinar. Why? That's a good question. So why should we be learning about transgender issues? Well, I think there are many reasons for this. And here are a few of them I want to go over. There has been an increased visibility of transgender people in society, and improved laws have provided new opportunities for transgender people to come out. You may recognize some of the people on the slide above. Laverne Cox, who's a famous actress from the TV show Orange is the New Black. Chaz Bono is the son of Cher. Jazz Jennings is the next person, and she's an incredible young trans woman who has her own TV show called Becoming Jazz, and she authored her own book called Becoming Jazz. And then lastly, there's Caitlyn Jenner at the end, who came out as transgender last year. And so, these are some of the people that have been in the media who've sort of sparked this conversation about what it means to be transgender. And I think that is important to recognize that because of that, we are talking about this issue for the very first time, probably as far as I've been around, where people in most homes are talking about what it means to be transgender. And that's pretty exciting, especially for someone like me who's transgender. So another reason why we're doing this is to become more familiar with who transgender people are and understand their needs. And understanding their needs helps you do a better job at whatever you do. If you're a substance abuse counselor, definitely understanding what it means to be transgender is going to help you do a better job. Transgender individuals need access to services just like anybody else. And I think that is a really important thing to sort of reiterate, that all of us need access to services, whatever those services are. And being transgender is just a part of whatever our identity is. So I think it's important to recognize that transgender people need all sorts of services, like going to the doctor and going to the dentist, but also social services as well. And lastly, transgender people have an increased risk of many different things, unfortunately. And they are depression, sexual violence, substance abuse, HIV, AIDS, poverty, homelessness, and suicide. And later on, we'll go over some of the more details of that data. And I think some of these data points can change depending on how informed society is. So that's some of the reasons why we're going to be addressing transgender issues today. Personal story. So what does it feel like to be a transgender person? So I'm going to take a few minutes now to talk a little bit about my own experience as a transgender person. And I will sort of let you know that, my experience is very unique in that it's what my life has been for the last 49 years. But what I've learned in the last 8 years doing, working with and meeting transgender people is that my story is not that uncommon. And so you're going to run into people who have some similar stories. Not everyone's going to be like mine, but there's a lot of similarities into the way I found out who I was as a transgender person and how I grew up. So I'm going to share a little of that now. And so on the screen, you can actually see some pictures. And on the left side of the screen, there's 3 pictures of me when I used to present as a boy and a man. That little young kid over there in the upper left is me when I was in kindergarten. It's probably 5 or 6 years old, and I went to Cabot Elementary School, and I was in Miss Matson's class. And even then, I knew I was different. I knew then that I was a lot more like my 2 sisters than my 4 brothers. I knew that I liked to do the things they like to do. I like to borrow their clothing. I like to play with their friends, things like that. So I knew even then, by the time I was in kindergarten, that I was a little different. But when I grew up, this was the late 60s and early 70s, there really wasn't a lot of information out there about what it meant to be transgender. And so I don't know why, but I knew that I needed to keep some of those ideas and thoughts to myself. And so what I would do is borrow my sister's clothes or sneak into my mom's room and try on her makeup or jewelry, but I would do it in secret because I didn't want anyone to find out. And so I kind of did this for many years. In fact, I would steal my sister's clothes or even her underwear, and I would wear it under my boy clothes to school whenever I could, or I'd even wear it under my Little League uniform. I was fortunate. I grew up in a very big house. There were 9 of us in the house. I have 6 brothers and sisters. And so it was a little chaotic in the morning getting dressed for school. So I had the opportunity to sort of dress myself. I kind of did this for many years until I was about 11 or 12 years old. And my parents caught on to what I was doing. And that's pretty common. At some point, parents figure out what you've been up to, and they found my sort of stash of girl clothes and things like that, and they confronted me about it. And they were curious, and I could tell they were confused about what to do about their kid who was dressing in girl clothes. So they talked to me about that, and I really didn't have a clear answer for them. I was just really embarrassed that they found out. Fortunately, they didn't do anything horrible, and they could have. And I've heard of really terrible stories where parents say horrible things and do horrible things to their kids if they act and behave anyway differently than what's expected. And so, I guess I feel really lucky that my parents gave me some options at this point. And so, not knowing what to do, they asked me if I wanted to talk to someone about it. And they asked if I wanted to talk to a priest about it. And while I was only 11 or 12, I just didn't feel like I wanted to talk to anyone about it, no less a priest at the church. And so I made a deal with my parents and said I would never do this again. Looking back, of course, that was a lie. I continued doing that soon after that event, but I kind of kept it even more of a secret as I got older. So the next picture is me in middle school, and so I would go to school and be me, a boy. I did a lot of typical boy things, played on the football team, did track and field. My mustache started coming in because of my hormones. I was going through puberty. Started dating a few girls. But still in secret, it was still trying to be the girl that I was, but it was really difficult to do that as puberty set on. And then there's my high school senior class picture. Back then I became the senior class president, and I was captain of the football team and did all these things that were kind of the opposite of how I felt on the inside, but I didn't feel like I could be myself on the outside. And so that's me, from kindergarten all the way to high school. And there were a couple moments when I tried to be myself in public, but I was quickly teased or bullied and shot down. I remember there was a day in high school where I tried to wear a pink carnation on my white button shirt, and I got attacked in the lunchroom by a friend and called horrible names like sissy and faggot, and we got into a fight, and I was suspended. But I couldn't tell the principal why I was so upset, and I definitely couldn't tell my mom why I was so upset. And so, that made me really sad, but it also made me bury my identity a little deeper. And so I went off to college and pursued my education, and still continuing on being myself in secret and living another life in public. Things did not improve all that much. While there was some relief going off to college, I came home after freshman year, returning to my same family and my same friends who seemed, not as tolerant as my college friends. I got really depressed. And unfortunately, at that point, was the first time I tried to commit suicide. I just didn't feel like there was a future for myself as who I was. I thought I was too much of an embarrassment and too much of a burden on my family. And so I ended up in the woods not far from my parents' house with a belt around my neck. And here I am today. So that didn't go as planned. But that is not an uncommon story. And we're going to come back to this a little bit later. But, nearly 40% of transgender people have attempted suicide, many of us several times. And the number of people who think about it is even higher. I think it's close to 60%, unfortunately. And so I kind of lived for a very long time in secret. The identity of myself went on and on and on, and I lived this other life and went on and got married to an incredible woman and started teaching and became a high school teacher and coach. And I really liked that job, and it was something I look forward to every day, is going to school and working with young people and coaching. But on the inside, that still was really gnawing at me and was eating away at me with the idea of sort of living two lives. Became more stressful. And over time, my marriage was not going well, and my happiness and my depression came back. And so I had to make a decision. I had to make a decision about what I wanted to do. Did I want to continue and suffer and possibly have another suicide attempt? Or did I want to live and try to live openly, honestly, as a transgender person? And so after, working with a therapist and meeting with other transgender people, which was really incredible, I decided to embrace my identity and transition. And it was pretty frightening, I will say, because I was going to do this in full public view as a public school teacher in southern Maine. As I mentioned earlier, I became one of the first out transgender teachers in Maine. As I started this, I didn't know that. I just started doing it. And I really didn't tell a lot of people. I had a few close friends who knew, but at the school, really no one knew. And so it was really terrifying going to school that first day, not officially, but maybe more officially as a girl or as a woman. I'd been at the school for about 8 years, and everyone knew me there as Mr. Drew. And now it's going to be known eventually as Miss Drew, but I had to sort of figure out how to do that. And there really wasn't a roadmap for me. And so I decided to sort of dress differently and present in a more feminine way. And I remember that first day. It was a cold January morning, and I parked in the parking lot and had to go to the cafeteria early in the day to supervise students. And I was dressed more feminine. I had like skinny jeans, and I'd done my very light makeup and a scarf, and maybe I'd done my nails. And so I walked into the cafeteria, terrified that everyone was staring at me. And I looked up, and they weren't. The kids were just, texting and copying each other's homework. I walked over to the door to talk to some of the teachers. They noticed that I looked different, but didn't say much about it. They talked about the weather, and I looked across the lobby where a lot of students were gathering before school. And I noticed a student I had the year before in my class, and I noticed she had noticed me, and I could tell she noticed the difference. And then I noticed her talking to her friends, and I got scared. I got scared that she was going to make fun of me, that she was going to laugh at me and point at me. And I had this flashback to high school where I got teased for trying to be myself. And then she started walking towards me, which was horrible. My heart started pounding. I didn't know what to do. And then she stopped, and she looked at me, and then smiled, and said, "I like your boots. They're cute," and walked away. Those few kind words said by a high school student began to melt away years of fear that had built up inside. And I continued my transition and haven't looked back since. And so, the point of telling this story is it doesn't take much to make a big difference in somebody's life. Being kind is probably the most important thing. And Not, another thing I want to bring up is you don't know what's going on in somebody's life. So if you look at the pictures on the left, you can see me, and I look like this happy little boy and young man, but really I wasn't. Inside of me was a lot of anguish and confusion. And so not knowing what's going on behind someone's surface is important to recognize as well. So anyways, on the right are some pictures of me in the last couple years since I've transitioned. And life is definitely a lot better. I'm a lot happier. I can't say that it was all easy. Unfortunately, my job was eliminated a year after I transitioned. I did get divorced, and I did lose a few friends, and my family became very distant. But I have more friends now, and my family is even closer to me. I'm much happier now that I'm not living two lives. And so transitioning for me has been life-saving. And I couldn't have done it without the support of some incredible people, like my therapist, and a group of transgender people I met in Maine. So those are really important things to consider when you're talking to transgender people. Is what is their support system? Who do they have on their side? And I think I couldn't have done this without the support of a few really important people. So there's a little story of how I transition and what brings me here today. And there's a little bit more to it, but we're going to skip that for now and move on to some other things. So let's go on to the next slide. Oh, terminology. I think this is what a lot of people want to know about, is all the words that go into the LGBT community, lesbian, gay, bisexual, and transgender. It can be very confusing and is constantly evolving. I am constantly learning every day. Terms are changing. Young people are inventing new words for different identities. And so we're going to try our best to sort of tackle what it means to be transgender and all the words that go with it. So here are some frequently asked questions about terminology and identity. Number one, what's the importance of using someone's chosen name in pronouns? It's a really good question. What's the difference between someone's sex and their gender? Didn't know there was a difference? Well, we'll get to that. What's the difference between gender identity and gender expression? Yep, those are two different things. What does transgender mean? We're going to give you one definition, but there are plenty. What does it mean to transition? And I've already mentioned a little bit about transitioning. We're going to come back to that a little later. And then finally, does being transgender have anything to do with sexual orientation? I bet you thought about that. So those are some of the questions we're going to try to answer in the next part of our presentation. So what's in a name? Transgender individuals may use a name that is different than their legal name. Actually, many of us do that anyways. We use nicknames all the time. But changing your name can be quite difficult and expensive, depending on where you live. Also, some transgender people use different names in different spaces. They might use a different name at work versus home, or in therapy, or in school, depending on their safety and situation. I knew I used different names depending on where I was early in my transition. I had a license that had my male name, and I was dressed as a woman, and I wanted other people to use my girl name. And so that's a common thing that you'll run into. And so most importantly is just to believe someone when they tell them my name is. Ask a transgender person's prior or legal name only if it's absolutely necessary, and please do that discreetly. It's not polite to do that. There is a phrase that I'm going to point out. It's called dead naming. You can see it down there. Is the practice of using someone's previous name without their permission. It is disrespectful and can be very harmful if you choose to use someone's dead name. So make sure you have permission to use that name before you talk about somebody in the past. So for example, I have a previous name. My parents named me something when I was born, and I don't use that name anymore, even when I talk about my past. And so I've asked my family and my friends to refer to me as Gia all the time. And they've been really good about that. which is really nice, and I feel really lucky. Next, what's all the fuss with pronouns? I'm sure you've heard people talk about pronouns. All of us have the right to choose pronouns that best reflect our identity. You've never thought about your pronouns before? Well, we're going to talk about them right now. Transgender people may use pronouns that don't match your assumptions of that person. It is best to share your name and pronouns first, then ask others to share theirs. Not everyone uses pronouns, or the traditional ones we're used to. So I know that's a lot. Maybe you've never considered your pronouns. Maybe you take them for granted. Think about it now. Think about what your name is and what pronouns you use. Is it he, him, his? Is it she, her, and hers? Or is it something else? Many more young people are using other pronouns like they, them, and theirs because they don't fit into the gender binary. And then there are other people that use other pronouns like ze, here, and heres, or ze, them, and zers. And then there are people that don't use any pronouns at all. And that's fine too. Just use my name, and that works. I know some people have a hard time with they, them, theirs, because it doesn't sound grammatically correct. But it works. You'll get used to it. And they'd be appreciative of it as well. So like I said at the beginning of the presentation, my name is Gia. I use the pronouns she, her, and hers. And so when you're doing like group introductions, I think it's really important that you go around the room and do this and have everyone do this. Hello, my name is, these are my pronouns. And it's really helpful. Okay, so let's move on to the next slide. So what's the difference between someone's sex and their gender? This is a very common question. I think for a long time, we always think they're the same thing. But they're not. When we think of someone's sex, we're usually thinking about their biology and anatomy. When we're born, each of us is assigned a sex. And usually, that's based on visible anatomy, whether it's an ultrasound or after a baby is born and we look. And the typical sort of scientific explanation is there a penis or not a penis? So if there's a penis, that person is assigned male at birth. And if there's no penis, they're assigned female at birth. And that's pretty much it for the scientific inquiry into the sex that you are for the rest of your life. And as we know, that your sex is only one part of who you are. And we're going to talk a little bit more about the differences between sex and gender on the next slide. But not everyone fits into those two categories of male or female. So intersex is a term to describe a person born with both or ambiguous genitalia and or reproductive organs, atypical combinations of chromosomes, or hormones. Intersex people constitute 1.7% of the population. That's about as common as people with red hair. You may not have heard about intersex before, but it's a lot more common than you think. And so when we talk about people being either or, male or female, we're often leaving out people who are intersex. And so I think it's important to mention this group of people as well. And there's been great progress on supporting transgender people when they're born, as they develop, and as they grow up. You know, there was a lot of news this past year during the Olympics with intersex athletes competing in the Olympics. So it raised a little bit more attention to what it means to be intersex. So I just wanted to bring that up as a different category for sex. So let's talk a little bit more about sex and gender, specifically gender identity. It's a topic I really didn't understand until a few years ago. Gender identity is our internal sense of ourselves in relationship to gender. Each of us develops a personal identity, some of which is formed in utero. Often, someone's gender identity is congruent with their sex assigned to them at birth. For example, my sister was assigned female at birth, and she identifies as a woman. She is a cisgender woman, CIS, unlike her sister, Gia, who is a transgender woman. I know those are some new terms for you. So maybe you've heard the term cisgender before, or maybe you haven't. Cisgender is a term used to describe someone whose sex assigned at birth aligns with their gender. The prefix cis is Latin for on the side of. So instead of saying normal, in opposed to transgender, we use the term cisgender. It's more polite and more scientific. I hope that makes sense. But before we go too far, it's important to recognize not everyone has a gender identity or identifies with a gender. I know that sounds complicated. So there are some terms: agender, genderqueer, gender nonconforming, and non-binary. These are identities associated with people who don't have a gender and or do not subscribe to societal gender norms. Some folks who identify in this category may also identify as transgender. That's up to them. Let's continue with more on sex and gender. Next is gender expression. Gender expression is the way most of us show or perform gender to the world. Terms like masculine and feminine are associated with gender expression. Someone's gender or sex does not predict what their gender expression will look like or what their sexual orientation will be. So let's look at some examples. Before we get to that, let's have a discussion question. What's the difference between someone's sex and their gender? A, nothing. Sex and gender are the same thing. B, sex is more about anatomy and biology, and gender is more about how someone feels about themselves and behaves. C, sex is about who I love and who I'm attracted to. Or D, all of the above. What do you think? A, B, C, or D? If you put B, you are correct. Sex is more about anatomy and biology, and gender is more about how someone feels about themselves and behaves. Good job. So here are some of those examples I mentioned of women in various forms of gender expression. Some are very feminine, some are very masculine, some are very athletic, some are very docile, some are very aggressive, some are tough, some are pretty. And so you can see that while these are all women, their expressions are all very different. So there's no one way to express yourself as a woman. Same would go for men. All of these pictures are men, and their expressions are all very different. From a drag queen on the upper left, Louis XIV, Tom Brady, Prince, a wrestler, ballet dancer, a rock star, Hugh Jackman. Yes, these are all men, but they express their gender in many different ways. So this is an example of the diversity within gender expression. It's something that most of us use every day in our lives. So what about the term transgender? I think that's probably why you signed up for this webinar anyways. So a transgender person is typically someone whose gender identity is different than the sex assigned to them at birth. So for example, I was assigned male at birth, but I identify as a woman. I'm transgender. Being transgender is not a choice or a mental disorder. But choosing to understand your identity and embracing who you are is a choice. So it took me about 40-some years to understand and embrace my identity. And so now I identify as transgender. Even though I've been transgender my whole life, I didn't embrace it until just a few years ago. The word trans is synonymous with transgender. A trans woman is the same as a transgender woman, and a transgender woman is a woman. Does that make sense? Good. So a trans man is the same as a transgender man. The prefix trans is Latin for across, beyond or through. Two-spirit is an umbrella term used by First Nation and or indigenous people of North America to describe trans-like individuals. There are indigenous names for trans-like people all over the world. That's cool. So there's more about the term transgender and different terms related to being transgender. The only way to know if someone is transgender is if they identify as transgender. Unfortunately, there's no blood test or chromosome test. Gender dysphoria is a clinical diagnosis of someone whose sex and gender cause conflict and significant distress. This is an important term. It's also important to point out that not everyone who is transgender has the diagnosis of gender dysphoria, but many do. While many folks still identify with the term transsexual, it's not as popular today, especially in the USA. I don't mind the term transsexual, but other people don't like it. Crossdresser is a term to describe someone who dresses in clothes of the opposite sex. This tends to be more about sexuality and expression than gender identity. Some crossdressers end up identifying as transgender and transition. Others do not. Some other terms to point out are transvestite, transgendered, he, she, and tranny. These are outdated terms and in most cases are seen as very insulting. So please do not use them unless you have direct permission to do so. I know that's a lot. So now we're going to move on to transitioning. Some transgender individuals find it necessary to transition from one gender to another, and or from one sex to another. Transitioning can be social, medical, or both. Social transitioning may include changing names and pronouns and dressing and behaving differently. Medically transitioning may involve hormones like estrogen or testosterone, hair removal, and or various gender-conforming surgeries, such as a mastectomy, breast augmentation, facial feminization, a hysterectomy, orchiectomy, phalloplasty, and or vaginoplasty. The phrase sex change is no longer used. It should also be important to know transitioning is not a requirement for being transgender. I think a lot of people think that you have to transition to identify as transgender, and that is not the case. We're going to come to some reasons in just a second, but I do want to go back and point out some things about transitioning that may help on your understanding. And so for me, I transitioned socially first. I decided to go by a new name, and I asked people to use she, her, and her pronouns, and I started dressing and behaving slightly differently. That was my social transition. And for some people, that's all they may need to do to be happy. That really did help me quite a lot, but it wasn't enough. And so I decided, with the consultation with my medical doctor and my therapist, to medically transition. And so for me, what that meant was going on hormones. And so I take estrogen as part of my transition. I also went through puberty with testosterone as a young guy, or when I presented as a guy. And so I had a beard at one point in my life, which is really funny to think about. And so I had to have my hair removed from my face. And so that's a very common thing for transgender women like myself who went through puberty, is to have hair removal. And then there are other various gender-confirming surgeries. This phrase that is a lot more common these days is gender-confirming or affirming surgeries. And there are many different things that constitute gender-affirming rather than just one surgery. And so for trans men, a mastectomy is very common, to have breasts removed. And that can be done at most surgical locations across the country. And for women, like myself, some women need breast augmentation surgery to gain breasts. Some women also have facial feminization, which will feminize their face after going through puberty. People's faces and skeletal structures changes. And so there is some surgery that transgender women can do to soften their features on their face. Hysterectomy is a common procedure that many transgender men have. Orchiectomy is another common procedure that transgender women have. And then there are phalloplasties for transgender men. And then for women, there are vaginoplasties. I think most people just think it's a sex change, but nowadays there are many different things that people do as part of their transition, not just one thing. And so nowadays we don't use the term sex change, we use gender-confirming surgery. You may also hear the phrases sex reassignment surgery or gender reassignment surgery as well. So hopefully that helps you understand what it means to transition. It can be very short, over a matter of a year, or it can take years and years and years for somebody. Some people can start transitioning and then stop, and then wait, and then start again, and that's fine. So we're going to talk a little bit more about why people transition and why they don't. Before we do that, there's a quote from Laverne Cox, who is an incredible transgender actress. There is a preoccupation with transition and with surgery, and that objectifies trans people who really don't get to know and deal with people's lived experiences. And I think that is true out in the world, that people really get fixated on transition and surgery rather than the personal story. So I know this is about transition and we're going to get to the details here, but it's also not to lose sight of these are people's lives. I think it's important not to lose sight of that. So thank you, Laverne Cox. Great. So other transition-related issues. First, not all transgender people want or need to transition. Many do not transition for personal safety and welfare reasons, such as fear of reprisal, loss of family and jobs, job security, social rejection, and/or religious intolerance. Transition can be expensive. Many can't afford some of the costs, and while more insurers and companies are offering transition-related coverage, not all do so. So to reiterate, not everyone transitions for different reasons. Some people do not want to or need to. And then there's the personal safety issue. So some people choose to transition later in life so they don't lose their job. And so that's their decision. Transition is expensive. And insurance does cover some of the costs for some people, but not everybody. There's more. I know. So there are individuals who, once they transition, may not identify as transgender anymore. And they may choose to live stealth. Stealth is when a person does not reveal their identity. Author, TV personality, and trans activist Janet Mock worked and lived stealth for years before revealing her identity in Marie Claire magazine. And that's Janet right down there in the bottom right. Her book is called Redefining Realness. It's a really great book describing what it was like for her growing up as a transgender girl in Hawaii, and then transitioning and then going into hiding and not telling people she was transgender. It's a pretty incredible story, so I definitely recommend it. Look her up. So now we have another discussion question. This is exciting. So the question is, what does transgender mean? A, a person whose sex is aligned with their gender. B, someone who likes to dress in the clothes of the opposite sex. C, transgender is an adjective that describes someone whose sex assigned at birth is different than their gender identity. D, transgender means having reproductive organs of both sexes. So were you paying attention? I hope so. So is it A, B, C, or D? If you guessed C, you got it correct. Transgender is an adjective that describes someone whose sex assigned at birth is different than their gender identity. Hey, that's me. I'm transgender. Did you get it right? Good. Primum non nocere. I had to look that up. I didn't know what that meant, but it's Latin for first do no harm. I like that phrase. It's something we want to address about safety and security of transgender people. A person's transition, status, and/or transgender identity should be treated with extreme care and confidentiality. Breaking that trust can be a matter of life and death, and has the potential of irreparable harm. I cannot emphasize this enough. And while we've made great progress in terms of transgender awareness in this country and society, transgender people face really dangerous circumstances if they're outed and they're not in a safe place. Outing someone may cause economic collapse, expulsion from family and/or religious communities, divorce, violence, and significant social isolation. So, to reiterate, a person's transition status and/or transgender identity should be treated with extreme care and confidentiality. Thank you. Hope that sunk in. 41%. What do you think that means? Think about it for a second. So here is some data. Most of it is very painful, but I'd like to point out it's not inevitable. So let's go through each one. 12% of transgender individuals are HIV positive. That number is much higher for transgender women and 50% for transgender women of color. Unfortunately, the data is really complicated because most transgender people aren't recorded in national statistics. 14% of transgender people are unemployed. That's about 4 times the national average. So that means transgender people live in poverty more than anybody else, or more than other people. 19% of transgender people have experienced homelessness. 20% of transgender people have been refused medical care. 25% of transgender people have substance abuse issues. 41% of transgender people have attempted suicide. That's that 41% I mentioned before. 40% of transgender people are survivors of sexual assault. 57% of transgender people have been rejected by their family. And 97% of transgender individuals have been discriminated at work. Wow, that's really hard to read. I didn't think it'd be hard to read all that, but it really is. And unfortunately, you know, these numbers haven't really changed all that much in the last few years. And so I want to point out that these numbers are not inevitable, though. Things can change, you know, and I do want to point out the 41% on attempted suicide. That number can change really dramatically by having a supportive family and a supportive community. That number can go down to the regular national average. if a transgender person has a supportive family and community. So we work really hard to make sure that family members are on board and at work people are on board. And so we can change that suicide attempt number pretty quickly. So transgender people are diverse, talented, and ubiquitous. I know that's a fancy word, I'm sorry. That means we're everywhere. We come from every walk of life, we're every race, every color, every ability, every religion, every income level. And so that's important to recognize, that transgender people are everywhere and represent every different community. People always want to know how many transgender people there are in the world or in the United States, and that's a really hard number to figure out. Most recently, there was a survey that said that there are about 1.5 million transgender individuals in the United States. It's a pretty good number. That's about 8,000 right here in New Hampshire. And they are as diverse and competent as anybody else. And I think that's important too. That all the transgender people I've ever met and worked with, and that is hundreds if not thousands, all bring wonderful things to this life. They all want to share and contribute to society. They all have wonderful skills and talents. And I think it's just giving people a chance to do so is really important. And so that's why I think it's great you're taking this webinar. Cool. Oh, we're already on a few final thoughts. Uh-oh. So I'll go back through these really slowly and clarify some of these as we go through this. So number one, be honest about what you know and don't know, but don't expect a transgender client to be the one to teach you. So this is really important when you're working with someone who's transgender, and I've met so many transgender people who are forced to sort of clarify and teach the people they work with. And so if you're working with a transgender person and you don't all know all that much about what it means to be transgender, it's not really up to you to ask them, teach me what it means to be transgender. It's really your responsibility to go out and find information on what it means to be transgender and not put that person who is already in a compromised position to ask more of them. It's like that's really important. So if you don't know an answer to a question, so let's say a client asks you about transitioning or about hormones or about, do I need to meet with a doctor first or a therapist, or do I have to go on hormones first before having this procedure? And if you don't know the answer, say, that's a really good question. I don't know the answer to that. Let me research that and get back to you. So I think that's really important to be upfront and honest with transgender people about what you know and don't know. Don't put the transgender person in a position to be the teacher. Make sense? Okay, good. Next, being out, or the thought of being outed as a transgender person, can be terrifying. It's not the same thing as being lesbian, gay, or bisexual. They are different things. So let me try to clarify what that feels like about being terrified. I can attest to that. For most of my life, I was terrified that people were going to find out that I was transgender. I thought they wouldn't understand. I thought they would laugh and make fun of me. I thought all these horrible things. The reality is, it was bad, but not as bad as I thought. So that's the cool side. And it's also not the same thing as being lesbian, gay, or bisexual. And we probably went over that really quickly, so maybe I should go back and spend a little more time on why is it not the same thing as being lesbian, gay, or bisexual. And so when we look at the different dynamics of the LGBTQ community, lesbian, gay, bisexual, transgender, and queer, we tend to get lumped together all the time, as if we're all connected and all those parts are connected. But that's just not the case. And as we talked about before, my sex is not the same as my gender. My gender is not the same as my gender expression. And who I'm attracted to is not connected to those things either. So for example, My sex at birth was male. My gender identity is a woman. I express myself feminine, and I identify as a bisexual person. And so none of those really line up in terms of a traditional binary role. And I think that's important to point out, that my sex is one thing, my gender is something different, my gender expression is something different, and my sexual orientation or attraction is something completely different too. And I didn't want to spend a lot of time on sexual orientation and romantic attraction because that really has nothing to do with gender identity. That could be a whole nother training. But I do think people think that when you transition, that your sexual orientation will automatically change. And I think that's a historic notation that people have been talking about for years. I know people in my family just assumed that once I transitioned and started living outwardly as a woman, that I would immediately be attracted to men. I guess I just didn't know that I had boyfriends in the past. But I'm still attracted to men and women because I'm bisexual. So that didn't really change. But there's a funny story about that, actually. My dad, who turns 83 this year, and he's very conservative, he's very Catholic, and he has struggled to understand and that he has a transgender daughter. But over the last 5 years, he's done a really great job. At first, he didn't use my name, he didn't use my pronouns, and he wouldn't look me in the eye. But over time, with support of some friends and family, he began to understand that I am still the person I was before. I just have a better, prettier name, and I use female pronouns. But it took him about 5 years to come to understand me as his daughter. And so recently, I introduced him to my girlfriend, and I think that confused him, because I think he thought that once I transitioned, I would be dating men. Sorry, Dad. And so now he's trying to understand that he has a transgender daughter who is bisexual and has a girlfriend. Oh well, he'll figure it out. Anyways, so going backwards, being out or the thought of being outed as a transgender person can be terrifying. That I know. And it's not the same thing as being lesbian, gay, or bisexual. Okay, moving on. Not everyone likes being transgender. Many people think it's the worst thing that could ever happen to them. This is true, and I hear this all the time. There was actually a post this week on Facebook that someone mentioned how much they hate being transgender. They were not born this way. They wish they could go back and change everything. And so when you're working with transgender clients or people who are questioning their gender identity, you're going to find people who have a hard time embracing their identity, and they feel it's the worst curse on them in the world. And that's a hard thing to change, especially when life isn't going well for somebody. Maybe they're having a hard time at work, maybe they have a hard time with their family, things like that. And so they may see being transgender is the worst thing in the world. But you can't change that. Being transgender is something that you are born with. And whether someone wants to embrace their identity or not is really up to them. But I will say, try to stay positive. There are so many good things about being transgender. There are plenty of transgender people who live successful, happy lives. I'm an example of that. There are people who are transgender that have great jobs in all sorts of fields. There are transgender people I know who are firefighters, work on police forces, they serve in the military, they're teachers, they're lawyers, they're doctors. Being transgender should not be a roadblock to being yourself and being happy, but it can be very difficult, so just be aware of that. Follow their lead. Transgender people need to decide for themselves when, if ever, to come out and or transition. This is something that people always ask me, why did you wait till you were 43 years old to transition? That was the right time for me to do it. Yeah, I look back and go, God, I wish I would have transitioned younger. But who knows what would have happened to me 20, 30, 40 years ago if I had transitioned then. The world probably wasn't ready for that. And so I transitioned when I thought it was ready, and I've dealt with it. So please do not push someone to transition if they are not ready. They will transition if they want to and when they're ready to. I think that's something to recognize as well. Connect transgender people to other transgender people. Knowing you're not alone can be life-saving. This is probably one of the most important things that I have learned in the work that I do. It has saved my life, and it has saved other people's lives. Until I met another transgender person about 9 years ago, I'd never met anybody, and I just thought I was a freak. I didn't think there was a future for me. And that all changed when I met other transgender people. I got to hear their stories. I got to hear what they've been going through. I got to hear about their jobs and their transitions. And it really had a huge impact on my outlook of life. And so connecting transgender people to other transgender people is really important. And there are support groups all over the state of New Hampshire for transgender people to meet other transgender people. And so I would encourage that. And lastly, transgender people can lead very successful and productive lives. I think that is something to sort of recognize and raise up, that transgender people have all sorts of skills and abilities, and that we're beautiful people and we have a lot to offer society. So there are some final thoughts for this webinar on Trans 101.